Thrombosis and Thrombophlebitis by Stephanie Kennedy and Tiffany Close-Fibash. A 37-year-old male intravenous drug abuser was admitted feeling generally unwell with pain in his right groin following a recent injection into the right femoral vein. Past medical history reveals left groin venous thrombosis 2 years ago. He's experiencing hypotension, lactic acidosis, anemia, and substance abuse. Increased shortness of breath, pleuritic chest pain, and noted to be hypoxic with a wheeze and right-sided pleural rub on examination. He was diagnosed with femoral thrombophlebitis with septic pulmonary embolism. Anemia is deficient red blood cells or hemoglobin in the blood. The D-dimer test is fibrin degradation of protein fragments in the blood vessels, 2 cross-linked proteins of fibrin. Deep vein thrombosis is when blood flow is obstructed in the leg. Hypoxic is insufficient amount of oxygen. Lactic acidosis is lactic buildup in the bloodstream. Thrombocytopenia is deficiency of platelets in the blood. Thrombosis thrombophlebitis is inflammation of a vein caused by the formation of a blood clot. Venous stasis is impairment of venous flow. Globally, men are slightly more at risk than women. Asians, Hispanics, and Pacific Islanders are less likely to be diagnosed than Caucasian ethnicities. 10 to 30% of patients die within the first month of diagnosis. 1/3 of people with DVT will have a reoccurrence within 10 years. 5 to 8% of Americans have a genetic risk factor developing DVT. Nationally, up to 60,000 patients are hospitalized each year for DVT in Canada. Occurs approximately in 200,000 Canadians annually. 60% of patients who undergo hip replacement surgery develop DVT. Etiology: prolonged bed rest, stasis can occur following surgery. Pregnancy after birth, 4 to 6 due to high levels of estrogen. Varicose veins and postpartum complications may occur. Overweight or obese, birth control pills or hormone replacement pills. Cancer, smoking, age if you're over 60 years. Change in the color of the skin may occur without noticeable symptoms, pain, tenderness, and swelling. Muscle stiffness in the affected area, cramping, and soreness in the leg.
Pathophysiology begins as the Vicrotriad in the venous system. The Vicrotriad begins with 1. The vessel wall damage, then followed by the venous stasis, and 3. Hypercoagulability. Venous stasis obstructs anything that affects the venous flow of blood. The result is an increase in viscosity and the formation of microthrombi. The thrombus then grows and propagates. Thrombophlebitis can occur in superficial and deep veins in both lower and upper extremities. The most common cases are found in superficial veins in the lower extremities, the calves. Superficial blood clots tend to remain where they form and aren't likely to break loose. Deep vein thrombophlebitis occurs in deep veins which run to muscles. These are more likely to break loose and block blood supply. Deep vein thrombophlebitis tends to pool the blood to the distal area, obstructing the thrombus. This image shows the normal anatomy and blood flow in the leg and what DVT in the leg looks like. With improper blood flow, the leg begins to swell and turn red. Blockage is what's causing the blood to sit in the leg instead of flowing up to the heart where it needs to go, possibly leading to further complications. This can be serious if the clot ultimately blocks the blood flow to the lungs. Embolism: an emboli can travel through the heart to an artery in the lung, where it can block blood flow and cause potentially fatal complications. Predisposed to thrombus: stasis of the blood or lagged blood flow presents in immobile or constricted blood flow. Endothelial injury occurs from trauma, chemical injury, IV injections, or inflammation. Increased blood coagulability results from dehydration, cancer, pregnancy, and increased platelet adhesion. Diagnosis: an ultrasound, contrast, venography, chest radiology, arterial blood gas determination, pulmonary angioplasty, magnetic resonance angioplasty, Doppler ultrasound exam, genetic testing for prothrombin G202108 mutation, and the D-dimer test. ICF model. His participation would be unable to walk to work due to shortness of breath, unable to walk far distances due to pain in lower extremities. Body function and structures affected would be his venous flow of blood, affect breathing patterns, increase activation of red blood cells and platelets. Treatment would be clot busters, blood thinners, Warfarin, ibuprofen, and other options including compression stockings. This concludes our presentation of thrombosis and thrombophlebitis. Thank you.